Hi, I'm Blake Bruton. This video is an assignment for my nursing ethics course at UALR. As nurses, we are honored to care for people. Working with patients and families to reach a cure for illness is one of the most rewarding things that I've ever done. But this is only one aspect of nursing care. As nurses, we often have patients to whom no cure is available. Caring for the dying patient can present many moral and ethical dilemmas. Many patients' families are not ready to accept a poor prognosis of a terminally ill loved one. And many times, this can lead to extraordinary measures that actually go against the patient's wishes and work to prolong suffering. In Nursing Ethics Across the Curriculum and into Practice, Let's Enrich 2008 referred to the familiar suffering and tormenting symptoms that dying patients and their families experience. These cases require a very special nurse-patient relationship that is built on a moral and ethical code. But who does the decision for end-of-life care belong to? It should be the patients. The American Nurses Association Code of Ethics First Provision calls for nurses to practice with compassion and respect of the inherent dignity, worth, and uniqueness of every individual. This includes respecting a patient's wishes on death and dying. It is our human right to decide what would happen to us if we were to end up suffering from a terminal illness. As healthcare workers, it is important that we present all of the relevant options to our patients. We must foremost practice truthfulness. We often see patients who are not fully aware of the seriousness of their illness. Whether it is the family's wishes or avoidance of discussing end-of-life issues, keeping this information from a patient strips away their autonomy. We have many patients who are suffering from incurable chronic illness. If given the opportunity, they might decide that the relief of symptoms and a pain-free death is right for them. These are issues that must be addressed, and they often aren't. We do not practice euthanasia or physician-assisted suicide in our country, but we must give our patients the choice to deny heroic life-saving measures that will not cure, but only lead to prolonged suffering. When our body loses the will to take in food, we can get a feeding tube. When our lungs lose the desire to take in air, we can be mechanically ventilated. Eventually, we will lose the control of our bowels. We will also lose control of our bladder. We even lose the ability to communicate to the outside world. In the best case scenario, we are still competent to make decisions about our own care. But in many cases, we even lose this ability. This is why it is important for us to consider these issues early. What is a dignified life? This is a personal decision that everyone should have the right to make. And as healthcare workers, it is our duty to guarantee that our patients are given the options before it is too late. Many countries actually allow terminally ill patients the option of assisted suicide. While this is not an option in the United States, we still have the right to refuse treatments that would prolong suffering and lead to an undignified life. Do not resuscitate and withholding life-saving measures are difficult options to discuss with patients. This becomes easier when the nurse-patient relationship is based on truthfulness and mutual respect. As nurses, we must work with physicians and other members of the healthcare team, as well as the patients and their families, to ease suffering and provide what comfort we can at the end of life.